So we've been participating in a new therapy for AL amyloidosis that targets the amyloid deposits that are in the organs. Currently, that's a major unmet need in amyloidosis. We have no therapies that are able to clear the amyloid deposits. We only have therapies that can reduce the production of the source of the amyloid through the use of chemotherapy directed at the plasma cell clone. So NEOD001 has been explored in patients with AL amyloidosis who have already received chemotherapy. They're already in an adequate hematologic response, and this antibody therapy is delivered monthly. And the early phase 1 study did show that it is an incredibly safe drug with no significant serious side effects, essentially, which is critical in this population that is quite ill with multi-organ dysfunction. The study that was reported at this meeting was an expansion cohort where we treated more patients, and in that we were able to confirm that the drug continues to be safe, and also importantly we were able to show that the responses in cardiac involvement and responses in renal involvement held up. So about 60% of patients will respond in the heart as well as in the kidney to this antibody, and also for the first time in a small cohort of patients with peripheral nerve involvement of AL amyloidosis, almost 90% of patients had a peripheral nerve response, which is also really an important finding. There was also a sub-analysis presented of this study looking at the impact of the chemotherapy the patients had previously received. A major critique of this study has been that perhaps the responses we're seeing are actually related to the chemotherapy and not related to the drug itself, the NEOD001. The chemotherapy responses were analyzed both from the time from last chemotherapy, the depth of response to the previous chemotherapy, the type of chemotherapy, as well as whether it's 6 months or 12-month landmark time points from prior chemotherapy. None of those features showed any impact on organ responses with this drug. So all in all, it's encouraging that we have a signal of activity of NEOD001 in the treatment of organ dysfunction in AL amyloidosis. So the next steps for this antibody are already in progress. There is a global phase 3 randomized study comparing standard chemotherapy for newly diagnosed patients with AL amyloidosis, and the patients are randomized to receive the NEOD001 or a placebo. They are also doing a randomized phase 2 study of patients who have already received chemotherapy and are in an adequate hematologic response, so a similar population to the phase 1-2 study, and they'll be randomized to NEOD001 or a placebo.